Hello everyone. Today's topic of discussion is about maxillary major connector. According to GPT-8, major connector is defined as the part of the removable dental processes or cast partial denture that joins the components on one side of the arch to those on the opposite side. These components include your direct retainer, indirect retainer, minor connector, rest, auxiliary rest, etc. Now we will discuss the various maxillary major connector designs. There are basically 6 maxillary major connector designs. The first one is your palatal bar, second one is your palatal strap, antero-posterior or double palatal bar, horseshoe or U-shaped major connector, closed horseshoe or antero-posterior palatal strap, and the last one is your complete palate. Now we will discuss each major connector designs. First one is your palatal bar. Anything less than 8 millimeter is considered as bar. If the width is more than 8 millimeter, it is usually called as a strap. So, bar running across the palate, which is half oval in cross section, which is thickest in the center portion. So, it is mainly indicated, your palatal bar is mainly indicated in cases of class 3 situations when we have to replace one or two teeth on either sides. The various disadvantages of palatal bar include, since it's bulky, patient finds it difficult to get adjusted to it. Since the anterior posterior width is less, it derives very less support from the hard palate. It cannot be used in cases where it is placed anterior to the second premolar, because if it is placed anterior to the second premolar, it can interfere with the tongue and can interfere with the speech, and it is also contraindicated in cases of class 1, class 2 and class 4 situation. Next is your palatal strap. As we discussed in the previous slide, a strap should have minimum width of 8 millimeter to have proper rigidity and to derive proper support from the hard palate. So it's a wide thin band of metal that runs across the palate. It is indicated in cases of class 2 and class 3 situation. Class 2 means a unilateral distal extension case, and class 3 is a situation where the edentulous space is bound by teeth both in the anterior and posterior aspect. Coming to the advantages of palatal strap. It is rigid. Since it is less bulkier than a bar, it is more comfortable for the patient. It derives more support from the palate as well. The disadvantages are, since the area of coverage or the anteroposterior width is more, patient may complain of excessive palatal coverage. Since the palatal coverage is more, there are chances of tissue hyperplasia, and it is contraindicated in cases of palatal tori. Next is your anteroposterior or double palatal bar. Here, there are two bars, one in the anterior and one in the posterior region. The two bars are connected by a longitudinal element that runs across the lateral slopes of the palate. The anterior bar is comparatively narrower than a palatal strap, and it is usually placed on the rugae valleys. Indications of anteroposterior palatal bar. It is indicated in patients who cannot undergo surgical excision of tori, patients who insist on less palatal coverage, and in cases of class 2, Kennedy's class 2 and class 4 situation. Class 4 means whenever there is a edentulous space and in the anterior region crossing the midline, and whenever the anterior and the posterior abutments are widely separated. Advantages: it is rigid. Since tissue coverage is less, it is more comfortable for the patient and less chances of tissue hyperplasia. It derives support from the horizontal as well as vertical slopes of the hard palate. That means it has got a strong L-beam effect. Disadvantages or a contraindication: it cannot be used in patients who are having high vault or narrow palatal vault because it can interfere with the speech. Horseshoe or U-shaped major connector. It is a thin band of metal that runs along the lingual surface of the teeth. Anteriorly, it extends or it covers the scingula, and posteriorly, it extends 6 to 8 mm onto the palatal tissues. Lateral border should be at the junction of your horizontal as well as vertical slopes of the hard palate. It is indicated in class 4 situation where there is a edentulous space in the anterior region that crosses the midline. In cases of inoperable tori and when the mid-palatine suture is very prominent. Advantages: it is reasonably strong. Disadvantages include it can flex on heavy occlusal load. So to prevent it, we might have to increase the thickness in the anterior part of the major connector. Closed horseshoe or anteroposterior palatal strap. As we discussed in the case of anteroposterior palatal bar, here instead of bar there are two straps, one in the anterior and the other in the posterior region. These two straps are connected by a longitudinal element that runs along the lateral slopes of the palate. It is indicated in cases of Kennedy's class 1, class 2 and class 4 situation where we have to replace numerous teeth and in presence of a inoperable palatal tori. Advantages: it is rigid. Since it is less bulky, it is more comfortable for the patient. It has got strong L-beam effect because it derives support from the horizontal and vertical slopes of the hard palate. Disadvantages: since it's a strap, area of coverage is more, there are chances of tissue hyperplasia. The last one is your complete palate. It is a thin band of metal that extends the entire hard palate. Posteriorly, it extends to the posterior palatal seal area, that is at the junction of hard and soft palate. It is indicated in Kennedy's class 1 situations with modification spaces both in the anterior and posterior areas. It is also indicated in cleft palate patients and when the tissue is flabby or there is a flabby ridge or if the palatal wall is shallow. Advantages: it has the best rigidity among all palatal major connector. Since the area of coverage is more, it derives good support from the palate. Disadvantages: since the area of coverage is more, there are chances of tissue hypoplasia and chances of speech interference. So to sum it up, this slide will give you an idea on which major connector to be used in various Kennedy situations. So in case of class 1, you can go for a closed horseshoe or complete palate major connector. Class 2, we can go for a palatal strap or a closed horseshoe. Class 3, we can go for a palatal strap or a palatal bar. Class 4, we can go for a horseshoe or a closed horseshoe or a complete palate. Thank you.